I'm Jessica, I'm 28 from Manchester, and I was diagnosed with cervical cancer in November 2015. I've always had irregular periods, so although that's a telltale sign, that wouldn't have been a telltale sign for me, which was frustrating. And then bleeding after intercourse, it didn't happen that often for me to think, oh, I best get to the doctors. So there wasn't really anything to indicate that could have been a possibility. After finding out my diagnosis from the doctor, it was kind of surreal, because you still got to go back into your normal activities of daily living, like looking after your kids, going home, cooking and getting ready for work. So fortunate for me, the time I got told was on a Friday, so I had a time before I got back to work to kind of digest it. But it was really surreal, because the nearest thing I could say is like an out-of-body experience, just watching yourself do things, and it's like, but this is happening to me. Being at work was the most hardest, because you can't fully concentrate on what you're doing, and your mind always ponders. And because you've just been diagnosed, so they're only planning treatment, you've not even started treatment, you don't want to discuss it with anyone. The radical hysterectomy was the first point of treatment that I had in December. But however, because there was some lymph node involvement, they decided that we'll have to continue with chemo and radiotherapy. However, because I had problems with my bladder, they decided that I am to go get bilateral ureter stents inserted. So we've had to wait to get a referral to a different hospital to get them inserted. And now we're going back to preparing for the chemotherapy and radiotherapy, because I'll be having both. Yeah. A consultant would see me every 2 weeks for planning for what's going to happen next, and then he made sure to tell me that if I had any problems whatsoever with like how I was feeling, or if anything didn't feel right, that I'm more than welcome to give him a call. So while I've been ill, it has been a bit of a worry for my husband to go back to work. However, due to his place of work being shut down for a refurbishment in January, it worked in favour of the time I went off ill. So it's been a whole month of January, and that gives him time to look after me and the kids, so he doesn't feel as scared to leave me by myself and worrying, because he's a worrier. So my relationship with my husband during this time, it's been good overall, but it's been a bit touch and go, simply because you don't expect it at 28 that your wife's going to have cancer. It's not a small illness like a cough or a cold, it's something big. And because you're not told the prognosis in the beginning, you just come up with the worst case scenario imaginable. So it's been a bit hard for him in the beginning. However, because of the family support we've had, he's done quite well. He's done better than me, actually. He's done really well with like the house, getting the kids sorted and taking over the school run. But you do have times where you do clash, simply because sometimes you feel they don't understand what you're going through, but in that same time you've got to remember that they are going through it, but just in a different way. They may not be experiencing what you're experiencing, but they're living with you through this experience. It's about sitting down and discussing them differences, and then you can work. It makes it better to work through together, and instead of having an enemy, you're developing a closer friendship. We've just had the GFR test, which is the blood test to see how my body reacts and my kidney reacts to treatment. And then tomorrow we'll be doing the radiotherapy mapping, and in 2 weeks we will be starting the radiotherapy Monday to Friday and the chemotherapy every Wednesday for 5 weeks. So it's moved pretty quickly.